Good afternoon, ladies and gentlemen, and welcome to the border of Mississauga, Malton, and Brampton South. I'm delighted today to introduce my good friend and a colleague of mine, the Minister of Health, Patty Hajdu. We had a very open and candid conversation. Residents of the region of Peel safe with Dr. Lowe, our Chief Medical Officer from the region of Peel. And so, without further ado, ladies and gentlemen, it is my honor again to introduce the Minister of Health, who is leading the charge at the federal level in helping us deal with this pandemic. None other than my good friend, the Minister, Patty Hajdu.
Well, thank you very much, Minister Baines, and all of my colleagues. It's so nice to see everyone in real life. We've been also, like many others, Zooming and working by distance, so to see people in real life is a real treat these days. I also want to thank Dr. Lowe for inviting me to Peel Region so that I could further our conversations that we've been having about how we help Peel get the numbers of COVID infections down. You are so blessed here in Peel to have such a thoughtful medical officer of health, and certainly the whole team. Also Deputy Andrews, who spoke with us about the enforcement perspective. This is a community that's really working together to try and protect the health of Peel residents, and they are working night and day. And I would say to Peel residents, we need to help them, because the work that they're doing, they can't do it alone. And as a matter of fact, I've said this all along, governments can put together all kinds of things to protect the health of Canadians and here in Peel residents, but we actually need everyday citizens to help work with us. And there are things, we know this is a sneaky illness, it's easy to catch. Some people are catching it in workplace settings, but far too many people are actually contracting COVID-19 in social settings. So I think Dr. Lowe said it best. If you can say no, say no. If you're invited to a dinner party, if you're invited to a gathering, if you're invited to a wedding or other type of setting where there's going to be lots of people and you don't have to go, say no. These are hard choices. I myself last week was invited to at least 2 different social events that I said no to. I wanted, though, to say yes. I wanted to be with my friends. I wanted to be with my colleagues. I wanted to come together to support each other during this incredible, difficult time. This is natural behavior of humans. When things are rough and the chips are down, we want to support each other. But we're going to have to choose ways to support each other from a distance. And that means doing the things that public health has been talking about, our leaders have been talking about since the very introduction of COVID-19. Washing our hands, making sure we stay physically distanced, making sure we wear masks when we can't physically distance, staying physically distanced even if we have masks on. And of course, the really important one, staying home if we feel even mildly sick. If you have a sore throat, if you have a runny nose, if you have a hacking cough, if you have a headache, if you've got tummy troubles, you're not feeling well, contact your health provider, contact your local public health unit, and find out if you should go and get a test. Because in fact, by doing that, you're going to protect yourself, you're going to protect the family that you live in, the friends that you have, and your community at large. And you're going to protect the economy of Peel. All of those things go together. We can't have a healthy Canada without a healthy economy, and they are actually intertwined. So I'm really thrilled to be here to meet with Dr. Lowe and his colleagues, and to be able to speak with the incredible hard-working public health officers and experts that are helping Peel reduce their risk of contracting COVID-19. And I'm happy to take your questions.
We'll take questions at this microphone right here. One question, one follow-up, please.
Hello, Minister. I'm Craig with Omni Television. So Ontario is reporting more than 400 new cases in the province today. The significant increase rates the concern the health unit's abilities to conduct contact tracing. So what is the federal government doing to support health units to conduct more contact tracing with the rise in cases?
Well, thank you very much for the question. First of all, I'll just point to the $2 billion that we have committed to Ontario, and that we committed in late April, early May, so that Ontario would have the time to be able to build up their capacity to do contact tracing, to enhance their capacity to do testing, and to improve their data processes. But on top of that, that's what I'm here today to speak about with Dr. Lowe. We have been also preparing surge capacity, a rapid response program, if you will, to help particular regions, just like Peel, that are experiencing surges. So we have federal contact tracers that are fully trained and available and working out of Statistics Canada in multiple languages. And Dr. Lowe is now working with the Public Health Agency of Canada to determine what types of numbers of contact tracers might be helpful here.
Hi, Minister. I'm Argan from Hamdard Media. My question is, how far are we getting from the vaccine? And when we get the vaccine, how this will be distributed to the areas? Will it go by the age group? It will go by certain areas, or it will go by the source of income to the people? And are logistically we are ready to do that?
Thank you. 3 questions in one, a smart reporter. So the first part of the question is how long till a vaccine? Well, really only science knows that. We know that companies around the world, scientists and researchers around the world are working on that very thing, trying to find a vaccine that's safe and effective and that will be available to a variety of different populations. And in fact, Minister Baines behind me is an active member in procuring vaccines for Canada and working with Canadian manufacturers, as well as putting together the vaccine task force, which are the professionals and experts that are guiding Canada about where to place our bets and which companies might be the most successful. We don't have a date, though, a timeline. Of course, we're hoping that we will be able to see a vaccine in early 2021, but science and research is tricky, as we can see, and even the most promising vaccines can have setbacks. So we continue to monitor very carefully that development, and of course, Minister Baines and the Vaccine Task Force have been instrumental in helping us make those decisions. In terms of how we will prioritize a vaccine and who will get it first, again, we have experts that are advising us on that. This will be a staged rollout. We will not be able to vaccinate 34 million or 37 million people all at one time, but we will actually work very closely with a committee that is actually a standing committee in Canada that advises on immunization of all kinds of different vaccines. And so we will, of course, be looking at things like vulnerable populations, people who work in very specific settings like clinical settings and long-term care homes, and we'll take the advice of that committee to make sure that we get it right. Ultimately, at the end of the day, in terms of the equipment, we are preparing. We are preparing from the ability to deliver the vaccine right now, both in terms of equipment and a plan to work with provinces and territories to get the vaccines to them very quickly and ensure that they have plans to distribute them efficiently. Thank you.
Hi, Minister. My name is Jack Seed, and I have a question from Prime Asia TV. As we handled well across the world, like we are the one of the country who has less COVID cases, and we are doing well with the COVID. Since pandemic began, there's no temperature check on the airports like here in Toronto Pearson. And I have a second question. Like Premier Ford said that the federal government is not doing well with the quarantine cases. What's your take on that?
Well, first, in terms of the airport temperature screening, that's in place now. But I will tell you, it's an imperfect science. And it actually doesn't catch that many cases of coronavirus for a couple reasons. One, not everybody that has coronavirus has a fever. And 2, people know how to lower their temperature. And many people do when they travel internationally to countries that use temperature checks as a routine basis. Nonetheless, we have added temperature checks at all our airports, including smaller airports like my own in Thunder Bay, as a matter of an extra layer of protection for travelers. In terms of the quarantine enforcement, I'll repeat what I said last week. Premier Ford was mistaken. Local law enforcement can enforce the quarantine. In fact, that's why it was important to have local law enforcement at this meeting. I really respect Peel Police. They are using a system of education first not everybody who breaks their quarantine means to. People don't understand necessarily that isolation means that you have to stay in that space, in your room. You should not leave your room except to go to the washroom. You should not share kitchen facilities. It's very hard to quarantine. So a lot of their work is about teaching people what quarantine means, but they also are able to lay charges if people are willfully leaving quarantine. We expect everyone who comes back from anywhere in the country to quarantine or anywhere outside of Canada to quarantine for 14 days. And local law enforcement is fully empowered to enforce the quarantine.
My name is Mohammed. I'm from Pakistan Times. The question I have is that, the government did a lot as far as the $2,000 a month they are paying, as well as the mortgages defer and things like that. So what do you see now? I think that this already stopped. So what the government is planning to do?
Well, I think, listen, we're not stopping. I think that's false to say that we're stopping. We're transitioning some programs into different platforms so that we can actually maintain them longer and use them more precisely. We knew early on we had to act quickly, and we implemented CERB. It was a bit of a rough tool because we had to act so quickly to make sure that people had the money they needed if they were staying home. But now, as we've had months to work through this, we're transitioning CERB to the EI program, and my colleague Minister Qualtrough is working very diligently on that so that people will continue to have income supports as we battle this pandemic together. We'll continue to look at the measures that we need to have in place, both for people and for businesses, because make no mistake, we'll have Canada's back through this. And if we have to adjust as we go because things change, because we see an increase in numbers, winter is coming, maybe we'll have to adjust and change those programs. But I have every confidence in my colleagues and the Prime Minister that he fully understands that we need to have Canada's back throughout this entire process. I'm sorry?
Like the mortgages defer, now their bank is asking for...
I can't speak to that particular element. Perhaps
Okay.
Minister Baines, do you know?
No.
Thank you very much, Patty. Just want to highlight again the issues around income support, liquidity support for businesses. These are issues that the local MPs here, including Ruby Sahota, Maninder Sidhu, Ramesh Sangha, Sonia Sidhu, have raised extensively. We recognize that we need to be there for Canadians. We need to support individuals, as you mentioned, through the Canada Emergency Response Benefit, through the wage subsidy, but also the business account to support a lot of the small businesses that make up our community here. And we're going to work very closely with the Minister of Finance as we move forward, and recognizing that we're still in a pandemic. We're still dealing with not only a health crisis, but an economic crisis. And as we restart the economy and talk about the economic recovery, it's important to continue to support individuals and small businesses and key sectors. As Minister Hajdu has said very clearly, we want to be very precise because in the past we've had very broad-based, agnostic approaches. So everyone was applicable to get the Canada Emergency Response Benefit. But if you look at certain sectors, for example, construction, or if you look at agriculture, they're doing reasonably well. If you look at tourism, or if you look at the GTAA and the airline industry, they're struggling. So we need more unique, tailored approaches, and that's exactly what the local MPs have been telling myself and the Minister of Finance and our cabinet colleagues. So I think it's a sign of confidence, as you noticed today, that we're working in close collaboration with Dr. Lowe, with the local law enforcement, but also with local community leaders to come forward with solutions. This is a bottom-up approach, and we're going to continue to engage the community and local organizations and local authorities to come up with these unique solutions. And that's why I'm proud to be here with my colleagues who are representing Brampton today, because they're a tremendous voice for the citizens of Bramptonians in Ottawa. Thank you.
Thank you. Thanks.
Next question.
Hi, my name is Usha. I'm from Namaste Newsline. I just had a question with regards to the border, U.S.-Canada border. Is it true that we're going to open on 21st, or is it going to be extended? Because we have a lot of family and people asking these questions.
Yeah. No,
Thanks.
the closure for non-essential travel has been rolled over another month to October 21st. Of course, we assess the situation month by month, and we work very closely with our American partners. But the decision has been taken by the Canadian government, by us, to extend the closure to non-essential travel for another month. Again, people who are essential workers, who are transporting our goods and services will still be able to cross the border, but this is for non-essential travel.
Thank you. We'll take one final question.
It's about one more for you. So Brampton has shown to be, unfortunately, one of the hot spots of the pandemic, and yet we've only got one sort of testing center, one drive-through testing center. Why doesn't Brampton have more test sites, Minister?
Well, thank you very much, and that's a great question for Premier Ford. In fact, the $2 billion that we committed in May was to provide the province of Ontario the ability to build up a testing capacity to, they were supposed to, by the end of October, have 78,000, the capacity to test 78,000 cases a day. They're about 50% of that capacity right now, and we expect them to stay focused on increasing that capacity. I have spoken with my health counterparts just as recently as last week, and I know that the Premier and the Minister of Health are actively looking at strategies to increase that capacity, including here in Brampton, including here in Peel. But it is important that we do this with the utmost urgency, because people do deserve to get a test when they need one. And I would just urge all residents of Peel to phone ahead to public health or to their health authorities or to their physician if they think they need a test before they show up at the testing site. That will make things more efficient and certainly help them determine whether or not a test is appropriate in their circumstance.
Thank you very much.
Thank you.